Welcome to Health Source of Madison Heights, Michigan. Today's topic, symptoms, causes, and treatment of sciatica. Sciatica most basically is the irritation of the sciatic nerve, which is the longest nerve in the body, arising from the sacral plexus in the lower back and threading downward through the pelvis through an opening called the greater sciatic foramen, then running through the hip joints and on down the backs of the thighs. The irritation typically actually has its origin in one of 5 root nerves that lead into the sciatic nerve rather than in the sciatic nerve itself. The symptoms compromising sciatica. Sciatica is not a diagnosis, but rather the name for a set of symptoms, which include pain in the lower back, buttocks, and/or parts of the legs and feet. As well as this sometimes severe pain, other symptoms could be muscular weakness, numbness, tingling in the legs, and problems moving or controlling the legs. Usually only one side of the body is affected. Causes of sciatica. Since sciatica is a name for the symptoms, not the cause of the symptoms, treatment varies depending on what the underlying cause may be. Causes of sciatica include pregnancy, piriformis syndrome, spinal disc herniation, spinal stenosis, trigger points, and sciatica-inducing habits. In the case of pregnancy, sciatica would result from the uterus pressing on the sciatic nerve and/or from muscular tension and/or vertebral compression due to the extra weight and postural changes from carrying the fetus. Piriformis syndrome is a condition that occurs in about 15% of the population, in which the sciatic nerve runs through the piriformis muscle instead of underneath it. Thus, when the muscle shortens or spasms as a result of overuse or trauma, the sciatic nerve can become compressed or strangled. A spinal disc herniation can press on one of the sciatic nerve roots. Disc herniation occurs when the liquid center of the disc expands outward and tears the external fiber ring, then protrudes into the spinal canal. This protrusion can compress a nerve root against the lamina or pedicle of a vertebra, and sciatica results. Spinal tumors or trauma can also cause sciatica. Spinal stenosis is a condition in which the spinal canal narrows and compresses the spinal cord. Cauda equina and/or sciatic nerve roots, bone spurs, spondylolisthesis, inflammation, or a herniated disc can all result in this situation. Trigger points in the lower back and gluteus muscles are a result of the muscles having low blood flow due to injury or chronic muscular contraction. In this case, the sciatic nerve is not being compressed, but the type of pain is similar. Habits that can cause sciatica include sitting on a wallet or on your feet for prolonged daily periods, or wearing a heavy tool belt that hangs around the hips and over time can result in misalignment of the sacral vertebrae. Treatment of sciatica. The best long-term treatments of sciatica are physical therapy in conjunction with stretching exercises, chiropractic adjustments to realign the spine, and massage therapy. Anti-inflammatory medications and narcotics may provide relief on the short term, but remember that when you use drugs that you're not treating the problem, only the symptoms, and many of these drugs have side effects that will lead to further medical problems if taken regularly for extended periods. Health Source would like to present you with a limited-time complimentary consultation, a $179 value. To find the closest chiropractic office near you, go to www.healthsourceofmadisonheights.com or call 1-888-977-6734 today.